I stood in my bathroom 3 weeks postpartum, staring at the mirror with my pants around my ankles, trying to understand why sitting, walking, and even breathing hurt so badly. The stitches pulled with every movement, radiating a sharp, burning pain that made me gasp. My midwife had told me it was normal healing, that I'd feel better soon, but when I finally worked up the courage to really look at what they'd done to me, I saw a jagged line of stitches extending far beyond anything I'd imagined. This wasn't the tiny tear she'd mentioned in passing while I was still foggy from delivery. This was surgical. This was deliberate. And as I replayed that night in the delivery room over and over in my mind, I began to realize something that made my stomach turn. I never said yes to this. I'd spent my entire pregnancy preparing for a natural birth. At 32 years old, working as a high school teacher with summers off to bond with my baby, I'd read every book, taken the Bradley Method classes, interviewed 3 different midwives before choosing Sarah, who promised me a woman-centered, intervention-free experience at the birth center attached to the hospital. I'd written a detailed birth plan. No unnecessary interventions. No episiotomy unless absolute emergency. I wanted to tear naturally if needed because I'd researched the better healing outcomes. My husband Jake and I had practiced breathing techniques, labor positions, perineal massage. I'd even hired a doula named Michelle to help advocate for me. I felt informed, prepared, powerful. I trusted Sarah completely. She had 20 years of experience, hundreds of glowing reviews, and a warm maternal presence that made me feel safe. When my contractions started at 39 weeks and 2 days, I labored at home for hours, just like we'd planned, breathing through each wave, believing I was about to have the empowering birth experience I'd worked so hard to prepare for. I had no idea what was waiting for me. We arrived at the birth center around 2 a.m. when my contractions were 4 minutes apart. Sarah checked me 6 centimeters. Excellent progress, she said with a smile that I trusted implicitly. The room was dimly lit with flameless candles. A birthing tub in the corner, exactly the peaceful environment I'd envisioned. But within 20 minutes, something shifted. Sarah kept checking the fetal monitor, her expression tightening in ways I noticed but dismissed. Baby's heart rate is dipping a little during contractions, she said, adjusting the monitor strap around my belly. Totally normal, but let's keep an eye on it. I asked if we needed to worry, and she patted my hand. First time mom nerves, she said. Trust me, I've seen thousands of births. You're doing great. But she didn't answer my actual question, did she? Looking back now, I see that as the first warning sign I missed the way she redirected instead of informing, comforted instead of educating. I wanted to trust her expertise, so I pushed down the small voice in my head that said something felt off. By 5 a.m., I was in transition, the contractions overwhelming and all-consuming. I'd moved to the birthing tub, the warm water offering some relief, Jake pressing cold compresses to my forehead while Michelle reminded me to breathe low and deep. Sarah checked me again 9 centimeters. Almost there, Mama, she said, but I noticed her glancing at the clock more frequently. What I didn't know then, what nobody told me was that her shift was supposed to end at 6 a.m. and another midwife was scheduled to take over. I learned later from my medical records that she'd already agreed to stay through my delivery, but she'd also scheduled a meeting at 7:30 a.m. that morning. Time pressure. That was the second warning sign I couldn't possibly have known about the external factors that had nothing to do with my body or my baby's safety, but everything to do with what was about to happen to me. At 5:45 a.m., Sarah suddenly said, "Okay, let's get you out of the tub and onto the bed. I want to check positioning." I felt a flutter of concern. I'd specifically chosen water birth as my first choice, but she was the expert. That's when everything accelerated in ways I wasn't prepared for. Sarah checked me 10 centimeters and said, "Okay, next contraction. I want you to push." But I didn't feel the urge yet. That instinctive bearing down sensation I'd read about. "I don't think I'm ready," I managed to say between contractions. "I don't feel it yet." Sarah's voice became firm, almost sharp. "Your body is ready. We need to get this baby out. The heart rate decels are getting more pronounced." I asked if the baby was in danger, my voice rising with fear. "We need to move things along," she said, which again wasn't an answer. That was the third warning sign, the sudden urgency without clear medical explanation. The pressure to push before my body signaled readiness. For 90 minutes, I pushed with everything I had. I pushed in positions they directed on my back, which I'd specifically said I didn't want, but Sarah insisted she needed to see what was happening. I pushed until blood vessels burst in my eyes, until I tasted blood in my throat from the strain. Through it all, Sarah kept saying, "Push harder. You're not pushing hard enough. And baby needs to come out now," even though the monitor showed my baby's heart rate was actually stabilizing. What I understand now is that directed pushing, especially on my back, especially that coached purple pushing they had me doing, actually increases trauma to the perineum and the need for intervention. But in the moment, I thought I was failing, that my body wasn't working right. That was the fourth warning sign, the coached pushing that set me up for the trauma that followed. At 7:15 a.m., with my baby's head beginning to crown, I felt the ring of fire they talk about in the books. It hurt terribly, but I knew this was normal. This was my body opening. I was breathing through it, and Michelle was saying, "Good, let your body stretch naturally," when I heard Sarah say something to the nurse that I couldn't quite make out. The fifth warning sign I missed was happening right in front of me, but too quickly to stop. Sarah reaching for instruments on the tray beside the bed, the flash of something metal. "Okay, I need you to keep pushing through the next contraction," Sarah commanded. I was mid-contraction, bearing down with everything I had when I felt pressure and then a sudden, shocking sensation that wasn't just stretching. It felt wrong, violating. Through my exhaustion and pain, I managed to gasp out, "What are you doing?" But Sarah didn't respond, didn't pause, didn't look at me. She was cutting. I felt it. The sensation of scissors slicing through my flesh is something I can still feel if I close my eyes. My daughter Emma was born at 7:22 a.m. screaming and pink and beautiful, placed on my chest while I sobbed with relief and exhaustion and something else I couldn't name yet. Through my tears, I heard Sarah say to the nurse, "Second-degree tear. I need to stitch her up." Tear. She said tear. Not episiotomy. Not surgical incision. Not, "I just cut you without your consent." I was too overwhelmed, too flooded with hormones and emotion to process what I'd felt. That was gaslighting in real time, the rewriting of what had just occurred before I even had time to understand it myself. Sarah stitched me up while I held Emma, working efficiently and quickly. "You did great," she kept saying. Just a little tear, very common for first-time moms. "You'll heal up perfectly." The discharge papers documented a second-degree perineal laceration repaired. Nothing about an episiotomy. Nothing about a surgical cut. My birth plan, which explicitly stated no episiotomy except in emergency with verbal consent, was in my file, but there was no documentation of any emergency, no record of asking my permission. But my body knew the truth. By the second day postpartum, I couldn't sit without a pillow, couldn't walk without shuffling, couldn't use the bathroom without crying. This isn't normal, I kept telling Jake. But when I called the birth center on day 5, sobbing because the pain was unbearable, the nurse told me, "Healing from tearing takes time. Keep using your peri bottle, take ibuprofen, it'll get better." 3 weeks postpartum, standing in my bathroom staring at the brutal reality of what had been done to me, I finally let myself acknowledge what I'd felt in that delivery room. That hadn't been tearing. That had been cutting. I demanded my complete medical records. Buried in the nursing notes, on page 11, was a single line. Midwife performed mediolateral episiotomy during crowning. Patient focused on pushing. Verbal consent assumed due to urgency of delivery. Verbal consent assumed. I never said yes. I'd said, "What are you doing?" But those words had been erased from the record, replaced with assumed consent, because I was in the middle of pushing when she cut me. I made an appointment with a pelvic floor physical therapist. She examined me and went very quiet. "This is a surgical episiotomy," she said carefully. "A fairly extensive one. It's healing, but there's significant scar tissue, and the angle is going to cause you long-term issues with pain during intercourse, possibly with pelvic floor strength. Did you consent to this?" When I told her what happened, Dr. Chen sat back and sighed. "I see this too often," she said. Providers who perform episiotomies without true informed consent, often because they're trying to speed up delivery for their own convenience. The research has been clear for decades that episiotomies don't prevent tearing. They often cause worse trauma, and they should only be done in genuine emergencies with patient consent.